So we'll see how to reduce a supracondylar fracture extension type, which is the most common in children. Here we are checking the radial pulse first, which is present in this patient. And now we'll give traction to the forearm and apply counter traction to the arm so that the lateral displacement and the posterior displacement gets corrected. Here we are applying traction. Once traction is applied, we'll flex the elbow, maintaining the traction in the direction of the forearm and maintaining counter traction as well. Now we are applying. Once the lateral displacement is corrected by applying traction, it requires some force if the swelling has set in. Now we are flexing the elbow and we are correcting the posterior displacement along with that so that the olecranon comes anteriorly. Here we are correcting the posterior displacement and flexing the elbow along with it. And in the last step, we have pronated the forearm, which has corrected the medial displacement of the distal fragment of the humerus. Now we are checking for the radial pulse, which is a very important structure to check to avoid a dreadful complication known as Volkmann's contracture. The pulse is palpable. We'll maintain this position and we'll apply cotton padding, and then finally we'll apply plaster of Paris and immobilize the elbow in around 90 degrees of flexion. The first step is the traction step, which is the most important step to disimpact the distal fragment. And then it is the flexion and posterior push to the olecranon. And last step is the pronation to correct the rotational deformity, as shown. Here we can see that posteriorly the olecranon and the triceps muscle has to be relaxed by giving a traction. In this figure, we can see why do we do pronation, so that the medial side of the periosteum is relaxed and the distal fragment becomes locked in that position to avoid any rotational deformity. Here again we can see we are giving traction and counter traction, along with we are applying force on the olecranon so that it comes back to its place. So again, giving traction and counter traction is the most important part in this reduction of the supracondylar fracture of the humerus. It will bring the lateral part towards the center. Now we are seeing, as we have reduced the fracture, the point of the olecranon has come anterior to the shoulder tip, and that is our clue that our reduction is successful.